Good evening, everyone. I am Dr. Stilana Trandafilova, and I have the pleasure to introduce you with the first presentation for today's webinar, the first of many, I believe. So welcome and enjoy. I'm going to talk to you about the skin quality and my perspective and how I see the skin, as I'm a dermatologist and this is my main passion. So I live in Sofia in Bulgaria, and I work in one of the biggest clinics in the country and one of the most innovative ones. And on a daily basis, we meet with a lot of patients. And what I notice is something like a trend going on in the past 2 years or even more. A lot of patients are coming as they're coming in your offices also, and they're seeking this kind of treatments for enlarging the lips or to volumize the cheeks or to contour the jawline or the chin. But something which is distinctive for all of them, and it's in general for all of them, is of course the skin glow they are seeking. So as we age, we know that we are losing the light. We lose the reflection of the light on our face. We're losing the radiance. And this is something that everybody wants, and especially women, of course. So we have this kind of skin trend, but for me, it's not only a skin trend because this is not going out of fashion, as you can see. As in the fairy tales, and the times are not changing about that, we are always seeking for this kind of delicate and glowy skin, the radiance. We want to have the porcelain-like skin, like the beauties in the fairy tales. So why is so important the skin quality for us? We have some biological, some evolutionary perspective about this subject, and this is what motivates most of the patients to seek this kind of aesthetic treatment, which can lead them to the dreamy glow. So in this study with 511 subjects, almost 80% of them said that they have this kind of desire for the more youthful skin, for more attractive appearance. And why is this happening? Because you know, the skin is like a business card for us, or as they said in the study, it's like the visual certificate of our health. It's not only the vanity, it's not only how we look, but it's improving our self-confidence. It's improving our psychosocial and professional well-being. And this is why it's very important to try to improve the skin quality and, of course, to slow down the processes of aging. But also skin quality can be an issue for many patients. We all have patients with different kind of skin conditions, with different kind of skin diseases, as the acne, the psoriasis, the eczema, and many more. As we are living in a society which is very judgmental nowadays, this can be like a social stigmatizations for all this kind of patients. It can lead to anxiety, it can lead to depression. I think that we all have patients with acne, especially the younger ones, pulling their hair up front to the face to hide the acne or to hide the acne scarring. So this is the reason why the skin health is not only the vanity. So it's essential for our mental well-being. And of course, we should never forget that this is the largest organ and it's our first barrier between us and the environmental bad factors from our side. So the patients are looking now for this kind of treatment that can improve their skin radiance, and we all know about this trend with the skincare routine. We heard about the 5 steps, now we have the 7 steps, and we have also the 10 steps, and probably in some time we're going to have like the 20-step skincare routine, and probably we should stay in the bathroom all day to do all the creams and tonics and serums. But as doctors, we all know that this is not working that much, no matter what we are using and how many times per day we are using it. So this is, I think, shown not only to the doctors, but now women have seen it. They have seen that they really have to take care of for themselves with something else. This is why in this survey, 2/3 of the women wanted to refresh their skin appearance by using an injectable treatment. And it's up to you as doctors to offer them the most rightful decision, the one decision which is going to give them the radiance and the glow of their skin. We know that skin quality is a big driver of the self-confidence. Probably this is one of the first reasons that especially women are seeking this kind of effect and results. But also because we are women and we want to have it all, we really want to have also the long-lasting results and solutions. So this was number one element of to drive the choice of the aesthetic procedure, which is going to give them the long-lasting glow. And this is something that you can achieve by using the right Galderma product for the broadest portfolio of the Galderma collection. And now, let's talk about the skin quality a little bit more. Why is so important and how we can define the skin quality? What do we see in our offices when we are having the consultations with our patients? Something that I really like to do when a patient comes into my office, of course, first I observe and I see with my eyes, but the next thing is that I touch. I always palpate the skin. I always want to feel what is the skin of the patient, what is the texture, if it's dry or not, or if something else. This is why we have different kind of features. We can summarize them in all 6 key aspects of the good skin quality that Dr. Anna Telengde is going to present to you in a couple of minutes, related strongly to the treatments with the Restylane Skin Boosters. But I'm going to summarize them, and the first kind of visual attributes, as we call them, or visual features, are the ones which are purely visible. This is the redness, this is the change in the hyperpigmentations or the hypopigmentations, so our skin is becoming to look duller or sallow, which means basically that around our 30s we are losing the glow and we are losing our natural color. So we start to look a little bit more grayish or yellowish or reddish depending on the skin condition in the moment. We lose the radiance and we lose the shine. Then we have the so-called mechanical attributes. So these are related to how the skin moves. We have the elasticity, the firmness, the thickness of the skin, the pliability of the skin, something that we can perform and evaluate simply by doing the simple pinch test. We should always do this. This is why I told you in the beginning of the slide. This is the way to evaluate the elasticity, because the elasticity is showing us how the skin can stretch and then return to normal, to its initial position, and if this is possible, something that you are going to see in the hand treatments that I'm going to perform. Also, it's very important to evaluate the firmness of the skin, the thickness of the skin, in order to evaluate the mechanical resistance when we apply some force onto the skin. Then we have the topographical kind of features, which are perceived only by touch, as I told you. This is the dryness of the skin. Is it hydrated? Is it not? Also the texture of the skin, the size of the pores, if we have acne scarring or some other kind of scars. Also we have the fine lines and wrinkling, and of course the roughness of the skin. And now let's talk a little bit about the skin aging. So as we age and as aging processes occur, and not only because of the aging, but also all these kind of environmental factors which are contributing to the aging process, of course, we are seeing that the collagen fibers are fragmenting with time, so they are disrupted. And this leads to the collapse of the fibroblasts. So when fibroblasts are collapsed, as we say it, they lose their mechanical support, and the mechanical support comes from the collagen fibers, which are gone with time, or they are broken, let's say, in other words. So the fibroblasts cannot counterbalance this kind of inward pulling which their own skeleton is doing, and this is why they collapse. They lose the support of the tissue. They lose the scaffold of the tissue. And this goes in two ways. One way is going to the downregulation of the collagen type 1. So we start to produce less and less collagen type 1. Also, Something else, and the other path which is going, is that we are increasing the activity of the so-called MMPs, or the matrix metalloproteinase, especially 1, 3, and 9. We know that all these MMPs, 1, 3, and 9, are leading to faster aging and to even more disruption of the collagen fibers. And this is how it goes. We lose the collagen, we lose the thickness, we lose the elastic fibers, and we lose the elasticity and stretchiness of the skin. And because of this, we are losing the HA, the hyaluronic acid, so we become drier and drier. And what is the solution of this? Of course, something that we can do is to revitalize the skin, because this is going to stop the process or is going to slow down the process. So I decided to ask ChatGPT to give me in, like 3 sentences, what it means to revitalize the skin, what's the essentials of the rejuvenation, and it was a really great answer. I'm going to read it for you. The essence of revitalization of the skin involves restoring its natural radiance, elasticity, and health. It encompasses techniques, products, and practices that nourish, hydrate, and rejuvenate the skin, helping to combat signs of aging, fatigue, and environmental damage. This process often involves promoting cell turnover, boosting collagen production, and enhancing the skin's natural barrier function to achieve a refreshed, vibrant complexion. And now the next question is how and with the help of which product we can revitalize the skin. Of course, these are the Restylane Skinboosters. So we have a study here which is showing us that when we are putting the stiffer kind of injected cross-linked HA, which means like the Nasha technology of the Restylane Skinboosters, into the thinned and aged skin, this is creating something like a mechanical support. It's creating the scaffold and the base, so the fibroblasts are irritated all the time. So they get mechanically stretched all the time and they are activated all the time. And the study shows that with time, we are having more and more collagen type 1 and 3 produced because of this irritation, let's say, in the good way, of course, of the fibroblasts. So we have the activation of the TNF-alpha, of the different growth factors, the inhibition of the MMPs, and this leads to more and more collagen. And this is why with some patients that we have with the treatment with the Restylane Skinboosters, even when we stop the treatment and we see the patients after months, like 5, 6, 7, 8 months, they look even better than we saw them the first time. And now I want to show you a patient of mine. So she is not a Bulgarian. She was living abroad and she told me, okay, I don't want to do the fillers. I just want to relax a little bit the upper third of my face. I want to try something else to rejuvenate my skin, to regenerate the skin, but we have 2 months before I go. And I'm like, okay, let's see, and let's try with the Restylane Skinboosters. As you can see, she's particularly a very thin-skinned patient. She has a lot of volume loss, especially in the temporal area, in the mid part of the face, in the preauricular area, also in the piriform fossa, and you can see the marionette folding. You can also see a little bit of sagginess here in the lower part of the face. It's not that much, as she has a really nice bone structure, but it's still there. And let's say that she is in her 60s. So I decided to go with Restylane Vital for the face, and I used 4 ml of the skin booster. So I did it in 2 treatments. The first treatment I did 2 ml, 1 per each side of the face, and after 4 weeks, as we mostly do the treatments with the Restylane Skinboosters, I did the other 2 syringes of Restylane Vital. And I got the picture, the after picture, on the 2nd month. So you can see that we managed to restore the skin volume, the plumpiness of the skin. She looks more hydrated, more full, and she looks like really revitalized. Also, we have the brighter tan. You can see it also in the semi-profile view of the before and after picture. You can see, of course, she's having freckles, which it's genetics, of course. We cannot fight with the freckles, but she's having also some hyperpigmentations. And even though we could make some more procedures, even only with the Restylane Skin Boosters, with Restylane Vital, we managed to brighten the skin a little bit, and the hyperpigmentations are not looking that pigmented anymore. You can also see something else which is very interesting. Only on the second month she has this kind of tightening of the face, like her face is shrinking a little bit. We have restored the volume of the mid part of the face. We have corrected a little bit of the sagginess of her face, and also even the OG curve looks improved with her. You can see also on the profile picture that she looks like much more lifted even. And let's not forget that this is Nasha technology. We are not using the Restylane Skin Boosters for their lifting effect, of course, because it's a skin booster, but with her we can see this happening. And now I'm going to show you her neck. So I decided to go, this is the same patient, to go for the neck because she really wanted a treatment for the neck also. You know that this is one of the areas where this is the new trend, let's say, after the face, because in the past it was one of the neglected areas of the women's body. But now every woman wants to do something for her neck. They want to hydrate, they want to tighten the skin, to plump, as the skin here is very thin. And Dr. Telenga is having a presentation about the neck and everything about the skin boosters with the neck. And she's going to tell you more about the anatomy and about how we can apply the skin boosters in our practice, especially regarding this area and the décolletage, of course. So with my patient, I decided to go with the Vital Light. So I am almost always using the Vital Light for the neck because it's the lighter one. Here the skin is very thin. We do not have a lot of fat tissue. And if we use the Restylane Vital here in this area, it's possible that it stays visible with time. This is why I'm going for Restylane Vital Light. It's like 12 milligrams per milliliter hyaluronic acid compared to the 20 milligrams per milliliter of the Vital. And you can see the same treatment protocol. We did it with the face, of course. I did 4 mL of Restylane Vital Light using the needle. The first treatment was with 2 mL. The second treatment was after 4 weeks with another 2 mL, and the after picture after 2 months, right before she goes back to her country. And you can see here how we managed to smoothen out the necklines and wrinkling. Also, we managed to tighten this really irritating area for most of the women, including me in this number, because this is one of the most unforgiving kind of area, and it's an ungrateful one, because the more you do, you have to do even more to see the result there. But with the Restylane Skin Boosters, it went very well for her. So you can see also the brightening of the skin. You can see that we managed to restore the dermal thickness and the skin volume. So she has really, really nice results. And now I am going to show you to Dr. Anna Telenga, and she's going to tell you everything about the Restylane Skin Boosters.
Hello, everyone. Did you know that Restylane Skin Booster is an original and the first registered injectable skin quality AHA product? And what is even more interesting, Restylane Skin Boosters is the most unique skin quality injectable, in my opinion, and I hope you will shortly share that opinion with me. Restylane Skin Boosters family consists of 2 products. Dr. Styliana already mentioned that there is a Restylane Skin Boosters Vital and Restylane Skin Booster Vital Light. They both contain lidocaine, which makes the treatment more comfortable for the patient. And they are amazing products because they are suitable for all ages of our patients, helping us to combat dryness, dullness, roughness, and uneven looking skin, and also to even acne scars. But what's the difference between those two products? Dr. Styliana already gave you a hint that the difference is the amount of hyaluronic acid that is locked in each syringe. In the case of Restylane Skinboosters Vital, we do have 20 milligrams per milliliter of hyaluronic acid, and therefore that particular product is suitable for all patients with a regular or rather thicker skin. As to Restylane Skin Booster Vital Light, which contains 12 milligram per milliliter of hyaluronic acid and is designed for rather thinner, more delicate skin areas such as perioral region, periocular region, but here I need to emphasize, but meaning periocular region, we do not mean eyelids, but rather lateral canthal line or a teardrow deformity. And also, Skin Booster Vital Light, as Styliana has mentioned, can be used in the neck region in that very delicate and thin skin area. So why is that treatment so unique? What makes it? What makes Skin Booster so unique? Well, let's think about it. Probably the first and most important reason for that is that the Restylane Skin Boosters take care of 6 vital skin quality issues. So skin boosters will provide deep hydration of the skin. They will enhance surface evenness by reducing pore size. Also, they will act on skin smoothness by reducing roughness and optimizing the texture of the skin. And also, they will help to achieve more even tone, as Dr. Styliana also emphasized as it comes to pigmentation and a sunspot in the patient's skin. And also, as it's a national technology HA gel, it can help us to decrease visibility of fine lines and wrinkles, and also can reduce scarring, post-acne scarring. So, what is the other benefit from Restylane Skin Boosters? Well, probably the second, I would say that this is longevity of the treatment and of the product. Restylane Skin Boosters is the longest lasting HA skin quality injectable on the market available at the moment. And it's not only the claim, but also we do have research and articles, publication that support it. So Restylane Skin Boosters, they do improve smoothness, they reduce roughness, and also improve skin hydration. And that effect is really long lasting because it can last up to 15 months, as it was shown in the research. And not only the effect was durable, but the level of satisfaction and also the satisfaction of the subject, so of the patient, and the evaluators, the doctors, were comparable during the whole 15-month time period. So the satisfaction was pretty high. And even if the subjects in the study were asked directly about different aspects of skin quality, about wrinkling, elasticity, hydration, and the radiance of the skin and brightness of the skin, in every single aspect, that satisfaction level was not only enduring during the first 3 months of the study, but also last up to 15 months of the study. So this is extremely unique aspect of Restylane Skin Booster. If we compare that to the claims that producers of other skin quality injectables are giving to us, we can summarize that Restylane Skin Boosters can act 15 times longer than Profilo, for example, or 1.5 times longer than Volite. So it is extremely unique that longevity of the product. And actually, our patients are not asking for a treatment, but they want to see results and they want to feel happy for a longer time with the results. And from the doctor's perspective, it's also quite important because basically we are quite busy in our offices and we don't want our patient to come too frequently. So we want them to come for other procedures, not only another skin quality injectables. So we can perform Restylane Skin Boosters treatment, and in the meantime, the patient will feel desire to do something else. Another uniqueness of the Restylane Skin Boosters family, Skin Boosters product, is the technology in which it is made. Skin boosters are the Nasha technology gels, the same Nasha technology that Restylane fillers portfolio, Restylane Classic and Restylane Lift are made in. Nasha technology utilizes natural entanglements in the hyaluronic acid chain, which is only stabilized by tiny amount of chemical linker BDDE. Nasha technology contains less than 1% of chemical stabilizing BDDE product, so that level of modification is the lowest from all the product skin quality injectables offered in the market. So another differentiator between skin boosters and the Restylane fillers from Nasha technology, of course, Restylane Classic and Restylane Lift, is the size of the particles. Particles of skin boosters are extremely small. Therefore, the product can be injected in the dermis directly, enhancing hydration and stimulating fibroblasts in the skin. So to summarize, the uniqueness of Nasha technology is that the patients are looking for a natural result. That's true, but also they want to use natural products. That seems to be quite smart, and Nasha technology is enabling us to offer them something extremely natural, because Nasha technology gels are closely mimicking actually the body's natural HA. They are like 99% similar to the natural HA that we have in the body. The second aspect is that small particles that we are using and two different concentration of hyaluronic acid gel in Skin Boosters portfolio, 20 milligrams in Vital and 12 milligrams in Skin Boosters Vital Light. Therefore, we can adjust the treatment and tailor it to patient needs. We can inject the product in the dermis. In the thicker skin, we can use Skin Boosters Vital, whereas in the thinner skin, we will go for Skin Boosters Vital Light. And the third and the last point to emphasize is that Nasha technology is impactful. And what I mean by saying impactful is that as soon as the product is injected, it is enhancing immediately the hydration and optimizing microenvironment of the skin. But also it gives like continuous optimization of the skin, promoting functionality of the skin and functionality of the protein like elastin, collagen, and also activating fibroblasts to produce more and more collagen and to rejuvenate our skin. And also that Nasha technology stays longer within the dermis than non-cross-linked hyaluronic acid technologies. So it is more durable and the effect is also more lasting, up to 15 months. So we have that long duration of effect and we have high efficacy. And also we have that instant hydrating effect after injecting hyaluronic acid gel, Restylane Skin Boosters. Both skin boosters are summarizing, they are locking moisture in the skin. They are also providing immediate and visible results, which is important for our patient. And again, they deliver deep hydration. And these are not the claims only, but these all points are supported with robust data that is available. And also, to cite one of the articles regarding that instant hydrating effect that skin boosters are delivering to the patients, we can see that that improvement is not only immediate after the injection, but also it persists over time after month 1 and even longer, up to 6 months, because that was the timing of that particular study. So Restylane Skin Booster is not a mesotherapy, and I would like it to make it clear, because in the past, some of the doctors were thinking that they can inject Restylane Skin Booster superficially, like like creating bubbles on the surface of the skin, but that ended up with disaster. Now we know that Restylane Skin Boosters, as they stimulate fibroblasts, they need to be located where the fibroblasts are present. So this is deep dermis. But what differs Restylane Skin Booster even more from mesotherapy is that actually mesotherapy, what was also stated in publication, that not give any significant histological nor clinical improvement in the skin, in contrary to Restylane Skin Booster. And also, this is a very interesting publication from 2011. That publication is by Polish professor, Professor Surowiak, who has also checked that injecting non-stabilized, non-cross-linked hyaluronic acid gel that does not improve at all pro-collagen synthesis in the skin. So if we know that mesotherapy is not working too much because it's not stimulating collagen synthesis and does not influence histology of the skin, and also does not give a clinical effect. So what about Restylane Skin Boosters? What is the mode of action of Restylane Skin Boosters, and can we really see the difference under the microscope? And actually in 2007, Dr. Wang has checked what happens in the skin after injection of Restylane Skin Booster. And he has found out that around droplets, micro droplets of Restylane Skin Booster, fibroblasts are becoming more active and they are more prone to production of collagen fibers. That was clearly visible under the microscope. And he ended up with hypothesis that the stimulatory effect of Restylane Skin Booster might be due to mechanical stretching of fibroblasts in the dermis, mechanical stretching of the dermis, and therefore that is like inducing enhanced collagen synthesis in the skin. And that was the sort of explanation that Dr. Wang gave, that HA injected into the dermis exerts a pressure on fibroblasts and then outstretches the fibroblasts that are surrounding that droplet of hyaluronic acid. And only those outstretched fibroblasts are becoming activated and produce collagen fibers. But, 2007 and now we are in 2024, quite a long time gap. So do we know anything more about Restylane Skin Boosters in between? Well, actually in 2023, there was publication which was really interesting that gave us an extra information about the mechanism of action of Restylane Skin Boosters. In that research, the Restylane Skin Booster was injected in the skin, but also there was the control without injection of Restylane Skin Boosters. And what they found out on histological sampling is that after injection of Restylane Skin Booster, the skin, there was a thickening of epidermis, and the skin looked rejuvenated from the eyesight, and the histological sampling, we could see that increase in collagen fibers in the dermis and also increase in fibroblast proliferation. But even more interesting is that we also know nowadays that hyaluronic acid acts in the skin through CD44 receptors and RAM receptors and influences expression of some genes. Among many, it influences expression of procollagen 1 gene, procollagen 3 gene, and also fibrillin, elastin, TGF-beta, and also connective tissue growth factor and also tissue inhibitor of metalloproteinases that Styliana already mentioned. And thanks to that inhibitor, it can inhibit photo damage in the skin, and also it improves expression of the gene for vascular endothelial growth factor. So the mode of action of Restylane Skin Booster is much more complex than we used to thought, but thanks to the publication and the discovery that Wang made in 2007 and the latest publication, we know that there is a lot of things that we will shortly learn about Restylane Skin Booster, and we know how actually that wonderful range of product works. And the last but not least amazing aspect and unique aspect of Restylane Skin Boosters is a syringe, a smart click system that can help us to concentrate on the patient and on the procedure, not on counting how much of the product we have already injected. That little orange smart click, which is hidden in the handle of the syringe, help us to divide the 1 milliliter syringe into 100 equal doses of hyaluronic acid gel. And actually, it gives us an audible feedback, a click, when every single dose is delivered during the treatment. So, it's like with driving. You can look at the steering wheel, but you want to drive, or you can look at the road and then you are not looking at the steering wheel. So it's exactly like with Smart Click system. You don't have to look at the syringe. You don't have to count the doses. The syringe is doing that for you, and you can concentrate on the procedure, on the patient. You can look at the skin. You don't have to look at the syringe. So it gives us a chance to focus on the injection technique. We don't have to focus on the product. And to support that we can see that the top line of the product that you can see injected on the glove contains identical droplets of hyaluronic acid gel, whereas the bottom line you can see has different volume, different shape. Simply that those droplets are not equal. And the top line was delivered with Smart Click system, and the bottom line was delivered without it. So basically, that's it. Simple things why Restylane Skin Boosters are so unique. And the fact that you know that Restylane Skin Booster is original skin quality injectable is the other aspect. Thank you.
Many factors control our skin health and radiance, including the strength and resilience of the extracellular matrix, ECM, providing our skin with hydration and structural support, home to elastin, collagens, and hyaluronic acid, maintaining skin elasticity. HA revitalizes the ECM by enhancing hydration, optimizing the microenvironment for elastin, collagen, and fibroblasts, promoting their functionality and improving skin quality and skin health. Restylane Skinboosters provide a unique skin quality enhancing effect based on the small particle and high molecular weight SB-NASHA technology, closely mimicking natural HA. It's the only HA skin quality injectable clinically proven to enhance 6 key aspects of skin quality, including skin tone evenness, diminished pores, smooth texture, deeply hydrated skin, and reduced fine lines, wrinkles, and acne scars for healthy, glowing skin. Thanks to the patented Smart Click syringe, SB-NASHA is injected in precise micro droplets into the deep dermis, creating an immediate hydration boost and mechanical stimulation. Its unique cross-link technology allows for long-lasting optimization of the environment, boosting elastin and collagen quality for enhanced skin health. SB-NASHA distinctively remains within the dermis longer than non-cross-linked HA technologies, with results lasting up to 15 months. Restylane Skinboosters is the only HA skin quality injectable clinically proven to reestablish younger skin characteristics, boosting skin health by providing 6 visible and lasting skin quality effects. It is versatile, applicable to the face, neck, décolletage, and hands, ideal for every skin type and tone. Thanks to 2 SB-NASHA gels with different HA concentrations, optimized for diverse skin thickness levels. Restylane Skinboosters is the only HA skin quality injectable clinically proven to provide 6 skin quality benefits for 456 days.
Having learned about Restylane Skinboosters' properties, technology, science behind it, a mode of action, so nicely summarized in the short video you have seen a minute ago, we can now move to more practical aspects. But before that, I would like to thank you for all the questions that you have already sent to us, and we are still waiting for more. At the very end, we'll have a Q&A session, and we will be happy to answer all your questions. So please do not hesitate, type your questions. Okay, so what is the treatment like? Because we know how Restylane Skinbooster work, but now we need to focus on how to inject it and what is the protocol. And of course, the recommended protocol for Restylane Skinboosters consists of 2 phases. The first is initial treatment that can consist of up to 3 injections, each 3 to 4 weeks apart. And the second phase is a so-called maintenance treatment or reboosting therapy. Every 6 months, 1 injection of Restylane Skinboosters. But please do remember that this is adjustable protocol, so 1 to 3 injections every 3 to 4 weeks, and then a maintenance treatment. But we need to adjust that protocol to patients' needs, to individual patient needs and desires, because finally we are the doctors and we can individualize the treatment and tailor it to the patient needs. So where and how to inject Restylane Skinboosters? We need to place the product in the dermis, but actually how and exactly what depth? That would be a smart question. Well, the area in which fibroblasts are most abundant is the really deep dermis, the junction between the dermis and subcutaneous tissue. So actually this is the depth in which we should place the product. So deeply deep dermis or the junction between dermis and subcutaneous fat. And how to inject? What is the treatment approach? And we can use either micropuncture technique or short linear technique or linear technique or phonic technique. whatever you like, whatever you feel comfortable with, and whatever you think will be most effective in every single case. We can either use a needle. 29 gauge needles are included in the package. Or we can use cannulas, 25 gauge cannula or 22 gauge cannula, depending on the clinical situation. Normally, I go for 25 gauge cannula in regular cases. And for example, in acne scar patient, I would rather go for 22 gauge cannula because we can also subsize acne scarring during the treatment. So the question arises, cannula or a needle? Which one is better? Which one is more effective? You know, some doctors claim that a needle is better because when we inject with a needle, we do more punctures, we puncture the skin, and some doctors claim that every single puncture of the skin would also give like a physical stimulation to the skin and a boost to skin rejuvenation and regeneration. Others say that when we apply a cannula, we can scratch the skin from below and also stimulate the skin that way, but reducing the risk of bruising, for example, or swelling or patient discomfort. Well, do we have any good answer for that? Can we stop that question once for good? Well, actually, in 2015, Gubanova has published an article in which she has compared injection with a needle and with cannula as go to efficacy and the effect on the skin. And actually, she has checked one side of the face was injected with a cannula, whereas the second part of the face, the other part of the face was injected with a needle. And she asked investigators to compare which side of the patient had better effect. And to be honest, there was no difference between sides. And also when the subject, the patients were asked, do they find the difference between the sides of the face? Also, actually, the results were quite consistent and there was no significant relevant difference between the sides injected with a needle or with a cannula. And also when the independent evaluators were asked to assess the effect of the treatment, also no difference was found by independent evaluators. So actually, which is better, cannula or a needle? I would say that that modality is better, which suits you better. So if you are a sort of a needle person, go for needle. If you prefer to use cannula, use cannula. Both are fine, both are effective. So now we need to assess whether the patient is suitable for skin booster therapy or if the skin boosters therapy is suitable for a particular patient. It all depends. But Galderma has provided us with a wonderful tool, which is called Galderma Facial Assessment Scale, that can give us a hint who will benefit from the treatment with Restylane Skin Boosters or other biostimulants. So in that facial assessment scale, as it comes to skin quality, we assess two parameters. The first one is loss of skin radiance or loss of skin glow. And the second parameter that we assess loss of skin firmness. And as it is numeric scale, 0 stands for an absence of the trait, and 3 stands for like severe expression of the trait. So if the patient has severe loss of firmness, we will grade it 3. And if the patient has like severe loss of radiance or loss of glow, we'll get 3 points. In the contrary, when the patient has hardly any loss of firmness, will be graded 0 points on the scale. We additionally may evaluate the level of skin hydration or the presence of blemishes like acne scarring, for example, or pigmentation changes. But who will benefit from Restylane Skin Boosters therapy? I would say that all those patients who's got loss of radiance or loss of glow will benefit from Restylane Skin Booster therapy as long as the loss of firmness is not like a predominant problem in their case. So patients with a high punctation in the loss of radiance and loss of glow, and very low punctation as it comes to loss of firmness. So firm skin, or rather firm skin, but dehydrated with loss of radiance, loss of glow. So the ideal patient for Restylane Skin Boosters is the patient who's got predominantly extrinsic aging. So extrinsic aging that is due to, for example, photo damage or dehydration, but also has mildly atrophic but firm skin. And also the patient that will have a sort of a dehydration or roughness of the skin also will benefit from the therapy. And presence of acne scars is another indication for the treatment. So now let's go together through assessment and treatment planning. So you can see that that patient has a pretty dehydrated skin. We can see that there is a bit of loss of radiance and loss of glow in that case, but the firmness of the skin is pretty good. Therefore, we can address the temporal region and the lateral canthal lines to prevent, well, actually the lateral canthus of the eye to prevent appearance of crow's feet in the future. And also we will inject Restylane Skin Boosters in the cheek region to improve skin hydration and to give her a little bit of glow. We also can enhance nasolabial folds with Restylane Skin Booster with the use, for example, with a cannula. In the case of the cheek region, we may either use a needle or a cannula, all depending on your preferences. In the temporal region, I would rather suggest to use a cannula just for the safety reasons. Some doctors use a needle only when they address crow's feet. So now let's check how the treatment plan would look like if we were to use only cannula. Again, we are using Restylane Skin Boosters in the cheek region from the one entry point on the zygomatic arch, and also from the same entry point we can address temporal region. We perform another entry for the nasolabials and marionette lines. And what is quite interesting is that we may also rejuvenate the lips with Restylane Skin Boosters, as vermilion is a skin, right? So we can also do that. So what is the injection technique as it comes to a needle? We need to, of course, disinfect the skin. It is wise to apply before disinfection and before procedure to apply numbing cream. We do activate Smart Click system, and then we place the needle at the angle 45 degrees to the skin, and then we turn the needle to become parallel to the skin. It is extremely important to be on the right depth, deep intradermally, when we use the needle. And how can we make sure that we are at the right depth? We know that the outline of the needle is less visible when we are deeper in the skin, and the moment we are becoming too superficial, we can see the grayish color of the needle, and also the outline of the needle looks a little bit sharp, and then we need to change the depth of injection. It is also reasonable to change the needle after application of half a syringe of Restylane Skin Boosters. And the one question arises when we think of the procedure on the face: how much product should we apply during one sitting, during the one procedure? This is my tip. In my opinion, one area of the surface of the hand is one syringe of Restylane Skin Boosters that can be injected on the face. So normally I do use one syringe of Restylane Skin Boosters on one side and the second syringe of Restylane Skinboosters on the other side of the face. So that makes it easier for me to assess quantity of the product needed for injection. In the case of the patients with a bit thinner skin, we need to make sure that we are at the right depth. And this is something I would like to show you at the moment at the video. This is the right depth. We can see that the outline of the needle is smooth. The skin is tenting over the needle. And now you will see two superficial injection. You can see the grayish color of the needle. And the needle is too superficial. The outline of the needle was too sharp. I have removed the needle and went down into deep dermal plane, and that was correct injection. And of course, still using smart click system. How many clicks shall we apply during one passage of the needle? Normally 2 to 3 clicks. So I do click once when the needle is in totally in the skin, then I withdraw a needle halfway and then I perform the second click, and then I withdraw the needle a little bit more, and before the needle will go out of the skin, I give third click. This is my way of injecting Restylane Skinboosters with a needle. When we use a cannula, we can also use activated smart click system, or we may inactivate the system. It all depends what you will feel more comfortable with. I do love when the syringe is clicking, because I'm sure how much product I have placed during one passage of a cannula. Normally, I apply 5 to 10 clicks during one passage of a cannula. So the system is activated, the entry point has already been prepared before inserting the cannula in, and I'm tapping the skin to make the procedure more comfortable for the patient. And the second reason for tapping is because I prefer to put the skin against the cannula, not to push the cannula through the skin, because it's more pleasant for the patient and more traumatic. And then we are clicking while withdrawing the cannula. We can change direction and go to the cheek region. And again, we can feel that the cannula is placed superficially. It is scratching the dermis, so the subcutaneous tissue is just below the cannula, and I'm at the junction between the skin and the superficial fat pads. And we perform the injection all the way down on the cheek, ending around mandibular angle. And then perform the last entry point in the parallel to the corner of the mouth. And this is the correct depth of the cannula placed in temporal region. So you can see how nicely and smoothly the skin is tenting over the cannula. And again, the procedure around the lip area, improving marionette lines and nasolabial folds from the same entry point. And to be honest, you may also use a similar entry point to rejuvenate the lips and marionette lines. And basically, we can now move to post-treatment, because we have finished our treatment. And what should we advise to the patient after injecting Restylane Skinboosters? So we may advise the patient to use cold packs to reduce swelling if the patient has such a tendency, or if it's necessary, or we see that there is a little bruising on the area that the product was injected. We can apply a soothing cream, for example, Cetaphil cream, and deliver a gentle massage to the patient's skin to make sure that everything is even and there are no palpable deposits of the hyaluronic acid in the skin. And after 24 hours, the patient may put some makeup on if the bruises are visible. And also, it is wise to mention that it would be wise to avoid any other cosmetic or injectables for another 2 weeks, just to make sure that there will be no collision between those procedures. And of course, we should explain the patient that the Restylane Skinboosters is a sort of progressive treatment, so it produces a gradual effect over time. So the patient see instant radiance of the skin, the glow, that the skin looks lighter, looks more hydrated, looks better. But we need to explain that the skin will be even brighter, even more beautiful, even better hydrated after a few more weeks or months. And these are the results of my patient, the one you saw me injecting. Initial, before the treatment, roughness, dullness, dryness of the skin. And after a treatment, 2 sessions, 2 milliliter per session, in 1 month interval, you can see that the skin looks better, it's more hydrated, that the nasolabials were more shallow in comparison with initial state. And again, look at the brightness of the skin. And you can see that this skin reflects light much better than before the treatment, and that both marionette lines and nasolabial folds, they look much better, rejuvenated. And a closer look, just concentrate on skin, because the skin is in the center of our concern today when we are talking about Restylane Skin Boosters. And this is something I've done in my office. I do have Observe, which is the technology that helps us to look even closer to the patient's skin. We can assess pigmentation, we can see vasculature, but also we can see how the skin is hydrated using that technology. And this is before and after, my patient before and after injection of Restylane Skin Boosters. You can see that there is a difference, that the little tiny fine lines that you can see around the eye are reduced after application of Restylane Skin Booster, and generally the skin looks healthier, smoother. And the last aspect of Restylane Skin Boosters, which I think is amazing, is that this is the perfect procedure for male patients, because they want to have hydrated skin, but usually they don't like using facials. So we can even combine Restylane Skin Boosters with Bond A, giving a relaxed and rejuvenated look in the upper third thanks to botulinum toxin, and improving the lower part and middle part of the face with Restylane Skin Boosters. Again, as it comes to male patients, normally use more cannulas than needles because they don't want bruises. They tend to be afraid of needles, so a cannula is a perfect choice for male patients, in my opinion. And this is again one entry point and application of 2 vials of Restylane Skin Boosters. And that's it. Simple. And now we will move to extremely vital topic, which are acne scars. Because acne patients are in our offices every day. So who would better talk about acne scarring than Styliana?
Hello again. I'm here to talk to you about to go with my second presentation for today's webinar, which is about the acne scars. And this is one of the most crucial and harmful issues for a lot of our patients, as we know. And as Anna said, we see them every single day in our clinical practices. So I'm going to tell you how we can really combine different kind of therapies, because I really believe in the combinational therapies approaches, and how we can use and incorporate the Restylane Skin Boosters in this kind of issue. So how many patients do you think that they are suffering from acne scarring? Why some people are healing with acne scarring and others are not? We don't know yet. So the studies are showing that whether in the studies, we have many acne patients who are healing with the acne scarring, and probably they are most of the half of them. And also we have this kind of a common phenomenon when even the mild acne can cause the scarring. As a person who personally has acne from time to time, I can tell you that I'm not scarring, but I see many patients who heal this way. And we have raised a lot of questions during the years, and I'm going to show you some really interesting studies about this matter. But let's now first talk a little bit about the scars. I prepared some histological pictures for you, and we can see there the normal skin and, of course, the histological features of the scar, the early one and the formed scar. So one of the main features is the disruption and the rearrangement of the collagen fibers. So they're not that good arranged anymore. They lose their kind of horizontal and, let's say, right arrangement. So we have an excessive fibrosis in the area. We have a thickening of the collagen bundles, and they stay like densely packages in the dermis. And also something very important is that we are losing our skin appendages. And clinically, this looks like some kind of irregular surface. We have the depressions, we have the elevations, so we are ruining the texture of the skin. So how a scar is born? We always start, we mean the acne scarring, of course, we always start with an inflammation of the pilosebaceous follicle, which is spreading around and is engaging the other follicles. So the way of the adult tissue to heal is to form the scar as it is healing. So we are formatting the granulation tissue, and we have the matrix remodeling. What is this meaning? We have the activation of the MMPs, or the matrix metalloproteinases, engaged here also. As I told you previously, they are having really active role in the skin aging process, but also here. And because we have this kind of activation of the MMPs, but also another inflammatory factors as the TNF-alpha, as the interleukin-1, like NFKB, and etc., they are causing the tissue damage. And the more prolonged is the inflammation and long-lasting and more severe, this is leading to a greater risk of acne scarring in the end of the process. Here's a very interesting study where the colleagues examined the 10 matrix metalloproteinases, MMPs, and their inhibitors, which are the TIMs, in a non-wounded fetal rat skin. And what they found that after the 19th day of gestation, which for the mice is a late one kind of gestation, we have an increase in the gene expression, especially for the MMP 1, 3, and 9, the one who were getting this role in the skin aging also. So they are strongly correlated with the onset of the scar formation in the non-wounded fetal skin. So the interesting here is that this matrix metalloproteinases on the 16th day of gestation, which is one of the early kind of gestation for the mice, are getting really lower kind of gene expressions. So they raise the question, what if we can somehow inhibit their activation? We don't know. Also, we have another interesting study about the fibroblasts. We have different families there. So in the skin, we have two different types of fibroblasts. We have the fibroblasts in the papillary dermis, and we have the fibroblasts of the reticular dermis. So for the papillary fibroblasts, they have this kind of anti-scarring effect. And in opposite to the reticular kind of fibroblasts who have the scar-forming effect. And here is the question, what if we can activate the papillary fibroblasts? Probably we can turn the process and the wound healing will become scarless, and probably we will go from the reparative kind of wound healing to the regenerative, which is the true one, and it's in the base of the trend of the longevity now. So, but let's get back to what we really know, and these are the morphology of the scars. They were described by Jacob et al., and we have different types of scarring, and here I showed the ice pick, the rolling and the box scars. Of course, we have the hypertrophic and the keloidal scars, but we are not going to talk about them today, as they have another kind of treatment approaches there. So the ice pick scars, we all know, is deeper than wider. They are very difficult to be treated with any kind of treatments, and this is why in the end probably they should be excised with some of the patients. Also, we have the rolling scars. They give this kind of irregular surface of the skin. They can be smoothed if the skin is stretched. So we have really nice results with energy-based devices treatment with them. But interesting with them is that this kind of a really good effect is not long-lasting, and it's coming back like in 6 to 12 months very fast. This is why here we have to always combine, and in my opinion it should be an injectable treatment as the Restylane Skin Boosters to create the mechanical support of the atrophy of the scar. And we have the box scars, which are one of the most common ones, and they are wider than deeper. They have well-defined borders and edge and shape, and we also can treat them with really nice results with the combination of EBD and other kind of non-energy-based device methods. We have different scales here. We have the ECA grading scale and the qualitative scarring grading system of Barron and Goodman. Of course, we have another ones, but these are one of the most popular through which we can evaluate the severity of the scarring. And now about the treatment possibilities here. We are having the energy-based devices from one side and the non-energy-based methods from the other. So we have the dermabrasion, the punch excision, we have the chemical peels like the TCA and the phenol, and we have the injectables. We have the HA fillers and we have the biostimulation and the Restylane Skin Boosters. Something that I really like to do is to combine treatments, and I really love the combination between Restylane Skin Boosters and Sculptra, because on one hand is giving me the anti-aging effect of the biostimulation, from the other we are taking care of the scars and we are getting also the glow of the face. There's a study here which is about the treatment of the acne scars with hyaluronic acid by doing microinjection points. And what is said in the study is that the microinjection of low viscosity HA offers a valuable technique for the treatment of the depressed acne scars. What does this mean, the low viscosity? It means that the product is behaving like a liquid. Why is this important? Because as we know, with the acne scar tissue, we have a lot of fibrotic tissue. This tissue is rigid, it's thick, and it's not very easy to be manipulated with. And this is why we need a product which is soft enough in order to be comfortable for the patient and for us when we are going with the needle. And also is very important the combination that this is a NASHA technology, because NASHA is the technology which gives the elevation of the tissue. So we are elevating the depression of the scar and we are making this kind of scaffold under the scar. What are the treatment protocols? We have mostly I'm using Restylane Vital for the patients with acne scarring. Of course, it depends on the skin quality, but most of the time we have the Vital. And this is like a basic protocol. The most basic one is 2 or 3 sessions with Restylane Vital every 4 weeks apart. And we can do 1 to 2 mLs per session on the patient. But as Anna told you previously, and I strongly agree with this, we have to personalize our treatment protocols. We don't have similar patients, so we have to personalize, we have to individualize according to the result that we are seeking and to the follow-up, to the result that we are seeing already. So this is why with most of the patients I'm starting with 1 or 2 vials, and then I say to them, we will see what will happen. And this is a patient that I want to introduce to you. I worked with Restylane Vital 4 mLs. This is a male patient, by the way. We had 3 treatments. In the first treatment, we had a lot of surface, a lot of area to cover. This is why we have 2 Vitals in the first treatment. And every 4 weeks, we have the second 2 mLs. So you can see that we have smoothened out some of the acne depressions, the acne scars. We have even managed to improve a little bit of the ice pick scarring. The skin looks more hydrated. We got rid of the fine lines and wrinkling also. Another patient who has the combination between Restylane Vital and Sculptra, one of my favorites, as I said to you. First, we decided to do the Sculptra biostimulation with 2 vials made every 4 weeks apart between the sessions. And then I continued with Restylane Vital 3 ml in 2 treatments again. So you can see that we restored the glow of the tissue, we restored the hydration, we smoothened out some of the fine lines and wrinkling in front of the ear, the vertical ones, which are really irritating for most of the people. And also we improved the scarring, we improved the size of the pores, which is one of the most important, let's say, aims that we are targeting with the skin boosters and with Sculptra. We have another patient in our clinic. This is a result of my dear colleague, Dr. Klaklova. She's an LMT for Galderma and for the lasers like PicoSure and Potenza. And she did this great result with a patient using the combination between PicoSure and Palomar laser and the Restylane Vital in 3 treatments, and you can see how great she looks like. We got rid of the ice pick scarring, we got rid of some of the atrophic scars. You can see how the skin looks hydrated and even the restoration in the mid part of the face. Another patient in our clinic, this was my patient with very severe case of acne, and I was treating him with isotretinoin for 10 months. And afterwards, Dr. Bittelska, my colleague from DermAct, of course, proceeded with the golden standard for the acne scarring, which are the lasers, of course. But also, we have here the combination between the lasers and between the Restylane Vital with 3 treatments, 3 milliliters every 4 weeks, and 4 weeks apart from the sessions. And I really can say that this is like the best result. It was a long journey for this young male patient, but he was very consistent, something that we should always tell our patients with scars, that it's not going to happen tomorrow. We need the time. We need to rearrange all of the collagen. And now I'm going to show you a patient of mine with acne scarring. You can see here that she has acne scars here and there, and she told me that they are more than 50 years of age. You can see that she has a particularly thick skin. So when I'm pinching, when I'm pushing, of course, we have the loss of hydration, we have the fine lines and wrinkles, but also the scarring. I just draw around the scars to mark them, and also she has some kind of a rolling irregularities in this mid part of the face. This is why I'm going to start with the cannula, and I will introduce Restylane Vital, because with the thick-skinned patient we need like a stiffer kind of product. I'm activating the Smart Click. I always use it. I really like the sound, and I really like to know what is the amount that I'm putting into the skin. And first I'm starting to subcise a little bit with the cannula. This is blunt cannula, 22G, 70 millimeters long. I really like to work with the long cannulas lately. It's my new love, because it goes really easy in the skin, and it's not that painful for the patient, by the way. And after I freed the skin from this kind of fibrotic bundles under there, I'm starting to inject the Restylane Vital, 20 milligrams per milliliter concentration of HA, because I like to create the support in the skin in the mid part of the face. And now I change the cannula with the regular needle, 29G. It goes in the boxes of the Restylane Skin Boosters. This is something I like to do for the patients with scars. I like to put a little bit of the product more superficially. But when I say superficially, I don't mean superficial in the upper part of the dermis. I mean in the lower part of the dermis. I subcise a little bit with the needle, and I'm putting the product there in order to elevate the scar and to create more smoothness appearance of the skin there. This patient probably will need 3 to 4 treatments. Here I used only 1 syringe of Restylane Vital, just because she was swelling a little bit, and I decided to wait. So the next treatment we can proceed, and probably we can use the 2 mLs with 1 milliliter per site. And thank you for your attention.
Right, so we have covered the face, we have covered acne scars. What about the other off-face areas in the body? Can we rejuvenate them as well with Restylane Skin Boosters? Well, have a look. This is the IFU of Restylane Skin Boosters Vital. So the IFU is like a Bible. It tells us what we can do with a product or what we can't do with the product. And if we have a closer look at the intended use of Restylane Skin Boosters Vital, we can read. Let me read it. This product is intended to restore skin hydrobalance, improve skin structure and elasticity of the skin. It should be injected in the dermal layer of the skin. This is what we told you already, and preferably in the deeper part of the dermis. But if we have a closer look into that paragraph again, there is no indication that it implies only to face. So actually it means that wherever skin needs improvement in hydrobalance or skin structure, we may take Restylane Skin Boosters and make a use of it. But we are doctors, we like to have a proof for everything. So I have found a proof in literature, in publication, that we may also use Restylane Skin Boosters in the other area than a face. So a wonderful study that show effectiveness of Restylane Skin Booster Vital in the face, in the hand, and in the décolletage region. So it has proof that quality of the skin is enhanced. However, you can see that the satisfaction after the injection, the application of Restylane Skin Booster in the décolletage is like is like a little bit lower than in other areas, mostly because this is very unique area that is really prone to photo damage, but also the skin in the neck and décolletage behaves a little bit different than, for example, in the face. Why is that? I already said that this is a sun-exposed area, and that's true, especially that our patients tend to forget about applying sunscreens in the other parts of the body than a face. So they do use SPF on the face, but then sometimes they apply a little bit on the neck, the remaining of the sun blocker on the neck, but forget about décolletage. And that is the reason why exposed area to the sun without sun protection photo ages quickly. The other aspect is that the corneocyte turnover rate in the neck region is much slower than in the face, and also that applies to décolletage. So the rejuvenating effect will be a little bit lesser in the neck region and décolletage than we can achieve in the face. What does it mean? It means that we may need a bit more treatments than in the case of the face, because this is very delicate and unique area. And also we need to remember that the skin in the neck is thinner than the skin on the face. Therefore, we would rather go for a smoother product, Restylane Vital Light, when we think of injecting the neck. And also the difference between the neck and the face is also extensibility of the skin and elasticity that is higher in the neck region than in the face. What does it mean? Does it have any additional meaning for us as injectors? Well, actually, yes. It means that the moment we make an entry point with a needle on the neck, and then we will try to put the cannula in, it might be a little bit more problematic than inserting the cannula in the face because of that high extensibility and elasticity of the skin in the neck region. So also we can find some deeper lines, deeper grooves on the neck regions, the horizontal lines, the venous lines, which are deeper usually than the lines we can find on the face. So also they will need additional support with Restylane Skinboosters. And why do we have that extra lines on the neck? Well, we need to look underneath the skin to find the answer, because the area in which we place our product is in the junction of the skin and the subdermal fat, which on the neck is called supraplatysmal fat. This fat layer is extremely scant normally in the normal weighing patients. So this is very thin area in which we will inject the product. And also the difference between neck and the face is that in the neck region we've got a really close attachment between platysma and the skin. These attachments are due to platysma fibers that penetrate the skin, but also due to ligaments that intersect in the skin and platysma, and then they divide the supraplatysmal fat into the little compartment, the little fat pads in the neck region. Of course, when we think of injecting the neck, we need to think about vasculature in the neck, and we do have cervical external vein with the branches and also submental vein with the branches that are penetrating platysma and supraplatysmal fat. Also, there are some nerves that we may also hit when we go too deep. For example, transverse cervical nerve that can be also injured when we put the cannula in too low in the mid aspect of the sternocleidomastoideus muscle. So basically, we need to remember that the area in which we will inject is really narrow. We need to be under the dermis, and there is like a very, very thin supraplatysmal fat, and the fat divides the skin from platysma. However, the platysma fibers may intersect the skin. Therefore, while inserting the cannula in, we may also cause some bleeding from the muscle fibers when injecting the neck. So we assess the skin in the neck region exactly the same way we assess the skin on the face. We look for dryness, we look for loss of glow, loss of radiance. We also detect some wrinkles. We need to check the loss of firmness of the skin. And is Restylane Skin Booster a product for every neck? I would say definitely no. If we have like excessive laxity of the skin, we would rather go for other biostimulating product like Sculptra. But if the skin is firm, but it lacks that dryness, it's dry, it's like more wrinkled, it needs some brightening effect, we will go for Restylane Skin Boosters. And in this case, the skin is quite thin. We can see just tiny horizontal lines, not very deep. So we can perform the procedure either using a needle or using a cannula. In that case, one side will be marked for needle, parallel injections of a needle, with using, of course, later on smart click system to deliver micro droplets of the product in correct places. And the right side of the patient will be injected with a cannula technique. And you may prepare one entry point or two entry points per side when we use a cannula. It all depends on the clinical situation. In that case, the patient didn't need more injection point. The skin was quite firm and it needed just a slight rejuvenation. So how do we perform the procedure with the needle? Of course, the skin is numbed prior to the treatment, then disinfected well. And then again, we insert the needle following the angle of 45 degrees. And then we make a parallel passage of the needle every single time, applying 2 to 3 micro droplets of hyaluronic acid. And we can perform it all the way down in lines, of course, coming back to the area in which we have that horizontal venous line on the neck, and we can also support that wrinkle with Restylane Skin Boosters injected with the needle. And you can see that the procedure is quite fast, hardly any bleeding, quite easy. But what about the cannula? When we use a cannula, we may struggle a little bit because of that elasticity and extensibility of the skin in the neck region. But the moment we are in the right layer, the procedure is not painful for the patient. It's quite comfortable. We can subcise a little bit those ligaments, and we can also subcise a little bit platysma fibers that penetrates the skin. So we also improve the overall impression after the procedure of the neck. And we go with the fanning technique, also delivering either micro droplets if you prefer to use SmartClick, or you can use inactivated SmartClick system, so just applying linear injections of Restylane Skin Boosters in the neck. So again, cannula technique in the neck. However, in that case, you can see that the patient has more prominent, more visible horizontal lines on the neck. Therefore, I have applied, injected Restylane Skin Boosters in a layering technique, firstly with a cannula, and then applying with the needle a Restylane Skin Booster directly into the wrinkle. Again, you can see that inserting the cannula is not a piece of cake when it comes to necks. However, the moment you are in the right layer, you can move cannula smoothly and the patient feels comfortable during the injection. And later on, activated SmartClick system or inactivated linear technique all depends on your preferences. But the important thing is that the bevel of the needle is facing down. Whenever you inject Restylane Skin Boosters with a needle, remember to keep the bevel down, because then you are sure that the product will be located in the deep dermis, in the deeper plane, not too superficially, to avoid creating any lumps or bumps. And as to décolletage, one more thing, of course, the thickness of the skin varies here. We also have sun-exposed area, we have scant superficial fat, but also we do have mammary gland to avoid. And therefore, we need to check well where can we inject our product. So normally, I ask the patient to squeeze a little bit arms so I can see how the skin is moving and where the wrinkle is visible. And also it helps me to avoid mammary gland in the upper aspect of the breast. And we can use fanning technique both with needle and the fanning with a cannula when we inject décolletage. Both techniques are easy to apply. Normally when I inject with needle, I do put the numbing cream prior to the procedure. And when we inject with cannula, we tend to prepare only 2 or 3 entry points depending on the length of the cannula we are using. But generally, in younger patients, we have no wrinkles, so we do procedure only to rejuvenate the skin and to slow down the aging process. We can also perform a linear technique, the parallel lines with a needle. Again, avoiding breast and being cautious in the subclavicular region, because injections are particularly painful for the patient. So remember about numbing the skin. And again, with a needle, we can perform either linear technique or fanning technique, but still using SmartClick system, which I really like. And again, implementing cannula technique, 2-3 entry points for the better result. In photo-damaged skin in older patients, we are rather using Restylane Skin Booster to follow wrinkles and to support the skin rather than a sort of a prophylaxis. So we are just following the wrinkles and injecting the product exactly where it's needed, where the wrinkle is visible. And again, for a photo-damaged skin, older patient, we may also use a cannula technique, again, following all the lines and wrinkles. And basically, that's it. So remember, we may use Restylane Skin Boosters not only in the face, not only to treat acne scars, but also we can improve the skin in other areas. And as we are talking about other areas, Dr. Styliana will share her experience regarding rejuvenation of the hands.
And I'm here to talk to you about the story of the hands and the Restylane Skin Boosters. Let's start with this, that hands are one of the most abused areas of our body, as we all know that they have a close connection to the all environmental factors of the surrounding milieu. So we have the sun exposure there, of course, and as Anna mentioned, for the neck, I think it goes even more the same for the hands. We are using the SPF for the face, but we also forget to use it on the neck, on the décolletage, and on the hands especially. So we have, after the COVID era and during the COVID era, of course, a lot of disinfection of the hands. We are washing our hands with a lot of soap daily, especially the doctors. We are using the gloves, the doctors. So this is, of course, leading to this signs of aging of the hands, which are visible, in my opinion, much faster than the other signs of aging. This is why we should really rejuvenate the skin there, and we should never forget to tell the patients that if they have a nice face, a nice neck and décolletage, they cannot have this kind of aged look of the hands. So we have different extrinsic factors which are activated here, and of course I said about the sun exposure, of course the smoking, and we have the other ones with the poor skincare. So we should always tell our patients to use the SPF, to hydrate a lot, to moisturize the hands a lot. Why is this happening? Because the skin of the hands is very, very thin. We lack of a lot of sebaceous glands there. This is why we feel the dryness even earlier. And sometimes it's even in our 20s. So we have the wrinkles, we have the loose skin, we have the thin skin here, we have the dry skin. And because of the photo-damaging kind of activities of the sun, we are having the age and the dark spots. Something that we are aiming for when we are revitalizing the skin of the hands is, of course, the skin quality, to improve the hydration, to improve the skin elasticity, but also to improve the plumpiness of the skin, because here we have a really thin fat layer and we're losing this layer very, very fast. So we are aiming to get rid of those marked tendons and veins, which are very oftenly we can see with elderly women and men, of course. So as for the anatomy, we have the skin as a first layer, and then we have the dorsal superficial lamina and the dorsal superficial fascia. Underneath is the intermediate lamina with the veins in it and the intermediate fascia. Then we have the deep lamina with the arteries and with the deep fascia, and then is the bone. Why is this important? Because in this dorsal superficial lamina, the one which is like the most superficial fat layer on the dorsum of the hand, we don't have any major risky structures as veins and artery. So we have different kind of techniques that we can inject the hands. One of them is the multiple point injection at the dorsum of the hand using the needle, 29G needle, probably with almost and approximately 20 microdroplet injections per hand per session. And the other one is using, of course, the cannula, blunt cannula. As I set to you. I have the preferability to use the 22G, 50 or 70 millimeters long, but also you can use the 25 or the 23 if you like, whatever you are used to. Anna said that's, no big of a difference if we're using the needle or the cannula. In my opinion, I just don't want to bruise the patients a lot because you can get a lot of bruising on the hands and it's visible. This is why my preferable method is to use the cannula. Something that I can share with you here is that while I'm using the cannula on the dorsum of the hand, sometimes I use the Restylane Skin Booster injected with the needle on the knuckles of the fingers and of the hands and on the dorsum of the wrist. This is one of the most dehydrated and, sac area, dry areas with the patients with the dry skin and with the patients with atopic dermatitis, and is giving really, really nice results. And as for the injection itself, what we can do with the patient, we can make them wash their hands, of course, as we are using our hands a lot, with soap and water, but afterwards we are disinfecting, of course. Then we have the patient position. If it's like the summer is coming, right, it's on the door, knocking on the door, we can position the patient in the Trendelenburg position in order to reduce the bleeding there, especially if we are using the needle. As an entry point, I like to use one entry point if I'm using my longer cannula, which is in the middle of the dorsal crease of the wrist, and then to go to the knuckles with the cannula. Or if my cannula is short, like 50 millimeters, I can make additional entry points between the metacarpophalangeal joints and go there with the cannula again. The layer of injection, as I said, is the superficial fat because we don't have any major structures there and we are very safe there. This is a study I want to present to you, which shows the changes in the skin quality and the clinical appearance of the hands after the microdroplet placement technique of hyaluronic acid in the aging hands. And this is the same patient. This is one patient that you are seeing the hands of. And on the one hand, she was injected with stabilized hyaluronic acid, other set Restylane Vital. On the other hand, we have an injection with non-stabilized HA. And you can see what is the result after 12 weeks. You can see that with the stabilized HA or the Restylane Vital, we still have the effect. We have even more brightness of the skin. We got rid of some of the hyperpigmentation of the skins, and we have the fullness here. And with the non-stabilized HA, of course, the effect is almost none. And you can see the same study with the hand of a 35-year-old woman. So this is to show us that the 35-year-old also need this kind of a hand treatment, and it's late in our 40s to start with the skin boosters. We have to start early. And here we can see how more hydrated and stretched the skin looks like without any kind of fine lines and wrinkling when we are using the stabilized HA on the pictures A and B. A is the before, B is the after. Another study, this is I tried to generalize the information for 4 studies, and these studies are showing us the high patient satisfaction from the skin boosters placed on the hands of the patients, and we can see that 85 to 100% of the patients were very satisfied with the results, and also 91% of them would repeat the treatment because they have seen the improvement in the skin elasticity, the improvement in the skin roughness of the skin. Another study which is showing the long-lasting effect. This was a study made among the Chinese population, 100 Chinese women. Anna said about this study. We have one hand injected with Restylane Vital, the other hand is not injected with anything. And the patients, we can see that they have a very high satisfaction throughout the 15 months of the follow-up. And we can see here that they have a significantly improved skin quality with reduced surface roughness and improved hydration, and for the 12 months of improved skin elasticity, which is showing us that the duration of the effect of the Restylane Skin Boosters is very, very long, even compared to the published studies and information for the other similar products on the market. And now I'm going to show you how I inject my patients with the cannula. I'm assessing the skin first, and you can see that she's very thin-skinned. We have a lot of wrinkling, dryness. I am drawing my entry point for the cannula, and it's in the mid part of the dorsal crease of the wrist, as I said. I'm making the entry point, and the cannula is 22G, 70 millimeters long, and I will use Restylane Vital. For the hands, we need Vital because need to volumize the area. We need to elevate the area more. And I'm proceeding with the cannula. I'm always activating the smart click. I like to work with this one. And here you can see that I'm very superficially when I pull my cannula up. So I am relatively safe. What I do with the patients as a treatment protocol most often is do 1 milliliter of Restylane Vital per side, so per hand. And afterwards, I call them in the office in 4 weeks to see. And sometimes it depends on the hands, of course. We need to do some more treatments, probably one more or two more, with 1 or 2 Restylane Vitals again per hand. And you can see that the procedure is not painful at all. When I compare it to the face, I think, in my opinion, also with the neck is the same, is less painful. So it's a very comfortable procedure for the patient. And this is the result of the patient before and right after the procedure. 2 mL of Restylane Vital using the cannula. We have restored the skin volume, we have restored the volume of the hands, and we have the less visible tendons and veins. And another result that I want to show you, which was 20 days after, for another patient, 20 days after the treatment with Restylane Vital, again 2 milliliters, 1 ml per hand, we can see not also the restoration of the dermal thickness and the skin volume, but we see a deep hydration and smoothen out skin surface, and also the color of the skin is improved and is going to get even better and better with time. So this is the last presentation from me for today, and thank you for your attention. And now, my dear colleague from Poland, Karolina Stupinska, is going to give you some really useful tips and tricks how to apply in your practice the Restylane Skinboosters.